CPR is an emergency procedure that keeps blood and oxygen flowing when the heart stops. The chest contractions help augment the heart's contraction and re-establish blood flow to the brain. When a patient collapses in front of you, ensure scene safety, but definitely do not drag the patient or try to do CPR in a seated position without a stable background. Following is a demonstration of the code blue drill at Pankaj ENT Hospital, Lucknow by senior ENT surgeon Dr. Pankaj Srivastav sir.
When there is an emergency in a hospital, this is called code blue. In this thing, we have to check three things. Pulse, so we have to check carotid pulse. Simultaneously, we will see the air movement and downwards chest movement. And patient is responding or not. Hello, photo. So if patient is not responding, carotid pulse is absent and respiration is absent, this is a practically dead patient. So we have to declare code blue in SDO area, code blue in SDO area. So your helper or a nurse or a assistant doctor will come with the code blue team. So there is a designated code blue team. The 5 people are there. One is chief resuscitator or a team leader, and second one is co-associator. Then there is a nurse. Then there is a scribe who notes down everything, the timing, the injection given, the action taken, and what is the response. And one is helper. So we have to declare code blue, and immediately we have to start cardiac resuscitation. So that is, we have to elevate ourselves. The resuscitator or a compressor will be on above the patient, so that his hands and the chest will go above the patient. This is the position we have to make. We have to lock our elbow so that there is no movement on the hand. We have to keep our hand on the sternum, exactly midline in the chest. Heart is slightly on the left side, but that doesn't matter in this situation. And we have to compress 120 times in a minute, and 2-inch compressions would be there. The principle is when the chest is compressed, the heart is also compressed because of a closed cavity. And this compression pushes the blood towards the brain. And the principle is if brain is dead within 4 minutes, there is no revival possibility. So if till the medical help arrive, our oxygen or intubation is there, we have to keep compression like this. And this resuscitation or a compression will not stop. This has to continue 120 times per minute so that there is a continuous circulation. The series is circulation, airway and breathing. So code blue now. When we declare code blue, there are resuscitators will crash cart trolley is there. Focusing. Crash cart trolley includes all the medication and oxygen cylinder. Then there is defibrillator. Then there is oxygen supply. Immediately, if the supply is available, we have a portable cylinder. We have B-type cylinder. We have got central oxygen supply. So whatever is available, we have to connect the oxygen with the mask to the patient till we are securing airway. Now, what are the options in the airway? What are the options for the airway? First is oxygen with mask, simple. Second, we have ambu bag with mask. We can apply ambu bag with mask. We can have eye gel. We can have laryngeal airway. And then final intubation. If the skill is there, intubation is the best thing. When it is intubated, patient has to be connected with oxygen. Now, when the airway is secured, the frequency will be 30 compressions and 2 respiration. Till that, there is no gap in compression. If the person who is giving, the team leader is tired, we have to change, and the changing position is very fixed. We have to move clockwise so that there is no problem and there is no time loss. Drip connection. Now, there are some medication, adrenaline, 1 ampule, immediately IV has to be given. After that, we have to keep atropine, dopamine, and everything, and they are needed later on. Adrenaline is given immediately, and we can repeat if the patient is not revived 10 times adrenaline. This is defibrillator. The person who brings defibrillator will switch on the defibrillator and connect the ECG leads immediately. ECG is connected, defibrillator is on, and ECG tells us what is the situation of the heart function. So there are two types of cardiac arrest. One is shockable and another is non-shockable. In shockable there is a ventricular fibrillation, and non-shockable will be a flat line. So if the patient is shockable category, we have to give shock to the patient. Now how we prepare? There is number one, switch on. Number two, it is joule selection. Normally we start from 200 joule because it is a biphasic defibrillator. After that, third one is charge. When we push the third one, both the electrodes will be charged. Charge. We have to be very safe because this is charged, and if someone touches this, he may have a shock and the heart of that attendant may be stopped. So we have to apply jelly, and one is a sternal lead, one is apical lead. This is the sternal. We have to keep slightly on the left from the midline, and this will be on the right side of the chest. When we touch the patient, we have to make sure that every staff and the person who is giving shock is safe. So we have to declare I clear, you clear, all clear, and there will be no metallic touch. No one is touching the patient, and then we have to give shock. Once shock is given, immediately we have to start CPR or chest compression. By the shock, the heart stops. That is the purpose of the giving shock. When the heart is in fibrillation state, it suddenly stops, and when we start CPR or compression, the heart starts again and patient may be revived. If by giving the shock there is no response, we can repeat with the joule increase to 200, 250, 300. So 3 or 4 times we can repeat this. In pediatric patients, we have a small pediatric attachment. So this is pediatric attachment, and the joule selection will be approximately 12 joule per kg body weight.
स्टर्नम कहाँ रखना है?
एपेक्स स्टर्नम का एपेक्स मतलब ये वाला इधर
लेफ्ट का पकड़े हैं। वैसे उल्टा रख सकते हो। अगर वो लिखा अपेक्स है और स्टर्नम पे रख दिया दे आर मेंट तो पहले आप ऑन करो। डिफी वही हैंडल करेंगे। आप लोग नहीं कंप्रेशंस करो। अब ये कंप्रेशन कर रहे हैं, 30 से चल रहा है।
अरे प्रिया क्या
अरे लेने
ड्रामा करो, एड्रेनालिन एड्रेनालिन। हां एड्रेनालिन जोर से बोल रहा है।
अब आप ही लोग
सर ने फोन नहीं उठाया।
एनेस्थेटिस्ट को बुलाओ। सर ने बदल नहीं करो बुलाओ। नहीं अभी अपना
डिफिकल्ट नहीं है, अभी आप ही लोग कर रहे हो। अब टीम लीडर ठीक है 16 के आसपास आ रहे, ठीक है, नॉट बैड।
7 line 11 30 40 50 70 80 90 50